You know, in plastic surgery, we have lots of interesting things that come up in interactions with our patients over time. And I'm delighted to have Judy and Pat as my guests tonight. And we're going to be talking about plastic surgery. And specifically, we're going to talk about some of the things they've done in the past. They're very open about their procedures that they've done, and they are happy to talk about it. And I appreciate that very much from both of you. And we're going to talk about what positive experiences plastic surgery has had on you and maybe on your life. And we're going to talk about some of the things that we look for in qualifications for plastic surgery and some of the specifics of it and some of the things that we do before and after the procedure. So I think, Judy, I'll just ask you first. Do you believe that, you know, like I do, that cosmetic surgery is positive changes for positive people and that it has a positive impact?
Certainly did for me.
Okay, good.
Totally did for me.
And what about you, Pat? Do you think that's positive changes for positive people?
Oh, most definitely.
Yeah.
It's improved my life 100%.
Yeah. So in what way? So give us some examples.
Well, now when I wake up in the morning and look in the mirror, I'm happy.
Yeah.
I start happy and stay happy all day. Before, you know, I have the energy, but I just didn't have the look to match it.
Yeah.
And I'm telling you, this is the best decision I ever made for myself.
Yeah,
It's
great.
awesome.
Judy, do you have similar experiences to that?
Yes. I did it for two reasons. One reason was for me, because I felt like I just needed to feel better about myself. I wasn't expecting to be perfect or anybody else but just me, but a better me.
Right.
And the other reason is I had started a company some years back, about that time. It was a small woman-owned company, and there's a lot of competition. And the competition is 30 years younger than you are. And, I mean, you know, that it's real. And you sit in those meetings and you're competing with somebody that looks nice and fresh and energetic. And there you are, you know, 58 years old and not quite as. So it changed my outlook on my business and my personal outlook on just me.
That's you know, one of the reasons that I like doing what I do, which is obviously plastic surgery, and particularly facial plastic surgery, which is kind of what we're talking about. So both of you guys have had facial plastic surgery, and of course our faces are always out there, so that's kind of the leading edge of plastic surgery. But what would, let's see, first of all, how long ago, Pat, did you have your procedure done?
2006.
Yeah. So we're now, this is 12, so we're 6 years out, and you look fabulous, and the longevity of the procedure is holding up great. And
yes, it is.
So,
it is.
So originally, Pat had forehead lift, eyelid surgery, a face and neck lift, and improved this area. We did some fat grafting and lasering around this area, and we also did your nose.
Yes.
And then we came back and fine-tuned your nose a little bit, maybe about 6 months or so later.
It was a year later we refined the tip.
Yeah, and got it a little bit more narrow and more to our liking. So that's what is known really as a total facial rejuvenation when we do the forehead, eyes, face and neck, the fat grafting, lasering, and all that. And the reason for that is because we want to promote balance and harmony in the face. So we look at our forehead, nose, and chin, and the relationships of those are very important as far as the aesthetic outcome for plastic surgery.